Hey everyone, and welcome back to Field of Vision with me, Nikki D. I am a glaucoma patient and I have been living with glaucoma for over 25 years. And I decided to start this podcast to help you. Maybe you have been newly diagnosed or have questions about glaucoma. So I'm here to help you through this journey. So today we are going to talk about something that becomes part of daily life for many glaucoma patients, including myself: eye drops. So, if you've been diagnosed with glaucoma, there's a good chance your doctor has already prescribed drops or may recommend them at some point. And when you first start using them, it's very common to have questions like, why this drop? Are there different kinds of drops? How do they work? And why do some people take more than one? I myself take multiple drops twice a day. The information shared in this podcast is for educational and informational purposes only and reflects personal experiences and perspectives. It is not intended as medical advice, diagnosis, or treatment. Always consult with your ophthalmologist, physician, or qualified healthcare professional regarding any questions you may have about your eye health or medical condition. Never disregard professional medical advice or delay seeking care because of something you heard on this podcast. So, today we're going to walk through the main types of glaucoma drops, what they do, and how doctors use them to help manage eye pressure. So, why are eye drops often the first line of treatment? For most glaucoma treatments, the focus on lowering intraocular pressure or IOP is the main concern. So, lowering pressure helps reduce stress on the optic nerve, which is the structure glaucoma affects. One of the easiest and most effective ways doctors can lower eye pressure is through prescription eye drops. These drops either reduce the amount of fluid the eye produces, improve how the fluid drains from the eye, or sometimes both. For many patients, drops are the first line of treatment, and these can successfully manage glaucoma for many years. So, one of the most commonly prescribed types of glaucoma drops is called prostaglandin analogs. These drops work by increasing the drainage from the fluid from the eye, which helps lower pressure. And as we discussed in previous episodes, when your eye pressure is too high, it can eventually damage the optic nerve. Doctors often prescribe these first because they are very effective at lowering eye pressure. They are usually taken once per day, and they are generally well tolerated by many patients. So, common examples of these include latanoprost, Lumigan, Travatan, and Zioptan. Some people may notice mild side effects like eye redness, darkening of the iris, or increased eyelash growth, which actually some people like. Your doctor will discuss any potential side effects when prescribing these medications. So, another category of glaucoma drops is beta blockers. These drops work differently. Instead of improving drainage, they reduce the amount of fluid the eye produces, which again helps to lower eye pressure. These drops may be used either on their own or sometimes in combination with other medications. So, a common example of this type of medication is timolol. Because beta blockers can affect the body beyond the eye, doctors consider a patient's overall health when prescribing them. And that's one reason why it's important for your doctor to know about other medical conditions and medications you may be taking. Another type of glaucoma medication is called carbonic anhydrase inhibitors. So these are like beta blockers. These drops work by reducing fluid production inside the eye and help lower your eye pressure. They may be used alone or in combination with other drops, depending on how much pressure reduction is needed. So, some examples of these are dorzolamide and azopt. For some patients, these drops may be prescribed when additional pressure lowering is required beyond the first medication. Another category is called alpha agonists. So these drops actually work in two ways. They reduce fluid production and they may also help increase fluid drainage. A common example in this case is Alphagan and Lumify. Because they have two mechanisms, they can be helpful for some patients when additional pressure lowering is needed. Doctors often tailor glaucoma treatment based on how each individual eye responds to the medication. It's like I said before, sometimes these medications can cause irritation in the eye, blurring, but they can also cause other side effects that are can be quite challenging for people. In some cases, doctors prescribe combination drops. These medications contain two different pressure lowering ingredients in one single bottle. So, the advantage is that patients may need fewer bottles and fewer drops throughout the day. Examples of these include dorzolamide and timolol together, which is Cozopt, and another brand name, Combigan. And there's also a prescription called Simbrinza. So, combination medications can make treatment routines simpler and may improve consistency with using drops. So, one thing many patients notice is that some people use more than one type of drop per day. And like I said before, I use multiple drops twice a day. That's because glaucoma treatment is very individualized. Doctors adjust these treatments based on how much pressure needs to be lowered, how the optic nerve appears, the visual field test results, and how the eye responds to medication. Sometimes one drop is not enough. Other times, doctors combine medications to reach a patient's target pressure. One of the most important parts of glaucoma treatment is consistency. Eye drops work best when they are used exactly as they are prescribed. Skipping doses or stopping medication without discussing it with your doctor can allow pressure to increase again. For many patients, drops simply become part of a daily routine, similar to brushing your teeth or taking other medications. And I know sometimes some people forget to take them, and especially if you're using multiple drops, it can be challenging to remember what medication you actually took. Typically, when you do take multiple eye drops, you're supposed to wait 3 to 5 minutes in between the drops. So what I do is I have two little cups, and when I put one drop in the eye, I remove the bottle from one cup and I put it into the other. That way I know that I've already taken it. I go about, do my thing, maybe brush my teeth, maybe dry my hair, maybe go eat breakfast, and then I come back into my bathroom at least 5 minutes later, and then I'll put the second drop in. And then again, I take it from one cup and I put it to the other. I find that this really helps me keep track of what medication I put into my eye. And I found that to be really the most effective way for me because believe it or not, you forget. You forget what drop you put in. So I hope that helps you out. So, if you're newly diagnosed with glaucoma and starting eye drops, it can take a little time to get used to this routine. Understanding how these medications work can make the process feel so much less mysterious, though. Your doctor chooses medications based on your individual eye health and how your glaucoma behaves over time. And for many patients, these drops play a very important role in protecting the optic nerve and maintaining your vision. And sometimes the medications have to be changed. Sometimes you might go a couple of months using one medication and your doctor may stop it and start using another medication. That can happen as well. Really important to stay consistent and to go to your appointments. One other thing that people may have challenge with is if they've never put any drops in their eyes at all, it can be challenging to get the drop into their eye. For me, I just look in the mirror and I open my eyes wide and I put the drop over my eye. I squeeze the bottle slightly. Sometimes you don't even have to squeeze the bottle. Sometimes the drop just comes out and the drop goes in the eye. For other people, they have to lie on their bed, open both eyes nice and wide, and put one drop in at a time. Believe me, you get used to it. after you do it a few times. So, thank you for listening to Field of Vision with me, Nikki D. If this episode helped you better understand glaucoma treatments, consider following the podcast so you don't miss any future conversations about living with glaucoma. And if you know somebody who has glaucoma, don't forget to share and like this video. Also, if you have any specific questions about glaucoma, please send them off to me. You can check out our Facebook page, which is Field of Vision on Facebook, and go ahead and leave a couple of comments. If you have any questions, I would love to address them on this podcast. So thanks a lot for joining me today, and we'll talk soon. Bye.